Now, my next guest, Dr. Rachel Clark, shared her first-hand experience of life within the NHS during the COVID pandemic in her best-selling book, Breathtaking. Well, now it's been turned into a new ITV drama that we can watch over the next 3 nights.
Just had a call from LAS. Might be the first one.
I'm not going to make it home this weekend, sorry. It's madness. There's currently no PPE at all. This is insane.
Owen, where's the defib? Where's the cross trolley? The public can be assured that we have a clear plan.
There's no plan.
Members of our team are wearing bin bags and going home wondering if they're going to die in the night.
Don't go there.
We're already there. You know this thing is spreading. They just keep coming. But no one is giving up. Prepare for the worst, but hope for the best.
Well, Dr. Rachel Clark joins me now. It's an astonishing drama. You feel as if you're right there. I mean, reading the book, we did get a real insight into what it was actually like at the coalface. But this, because it's a drama of the emotions, you must be, if you say pleased with it, sounds odd, but is it exactly what you wanted?
It really is. I mean, all of us, we had this really simple aim. We wanted to show the British public what it was really like inside those NHS hospitals. And we wanted to almost take the viewer by the hand and into this world, the sights, the sounds, the emotions, the fears that we all had that were almost impossible to imagine at the time because our world in the hospital was completely barricaded off from everyone else.
Of course it was.
Yeah.
But for us to do that, I think enough time has gone by in a way. I think it's a very important drama. And again, it brings home that the humanity under these horrific circumstances. You know, when people were dying, people were having to say bye-bye to loved ones on iPads. Yeah. And there wasn't enough protection. Yeah. People wearing bin bags. I mean, it was insane what we put you through.
It was astonishing. I mean, in those early days, it was so hard to go to work, to want to use all your instincts as a doctor, a nurse, all the other healthcare professionals to help patients, but literally be told there is no PPE for you. Sometimes if people brought in PPE that they'd bought themselves in a DIY shop, they were told, take it off, you'll frighten people. Sometimes staff begged their managers for PPE, they didn't get it. And all the time, the official government statements to the public were, there are no shortages, none at all. And of course, very, very quickly, our hospital, our intensive care started to have beds occupied by members of staff, a nurse, 2 porters in my hospital. And we knew that people were catching it in the COVID wards, and it was incredibly frightening. At times, we just felt like we were obviously expendable. We were just cannon fodder.
Cannon fodder is a word. I mean, it's absolutely chilling, but I think it does sum it up. It really does. What do you want people to take away from this drama? You know, ultimately, when we watch it, and I think everyone should. You know, bits of it are not easy to watch, but that's what good drama is. You know, it makes you think and it makes you. Well, actually, I watched it. I was raging, to be honest. I was angry and sad and frustrated and all of these things that a good drama should make you feel.
Yes. Well, I think most of all, I just want people to bear witness.
Okay.
This story hasn't been told. No one has really seen what went on inside hospitals, and I think it's really important, almost as an act of respect and remembrance for what staff went through and patients and relatives, to at least not turn away. And actually, the other thing that really matters to me is for the public to see on screen actually the good moments that occurred within this terrible, tragic, unfolding pandemic, because staff tried so hard to be humane and compassionate and loving towards patients despite our PPE, despite the fact that family members couldn't be there. We would hold the hands, we would talk to patients. We tried so hard to make sure that nobody ever died alone. And I think when the public realises quite how much effort and devotion staff put into caring for COVID patients, they might actually find some comfort from that.
Do you know, that's such a great point, because there are really, really inspiring bits in there and genuinely uplifting. You know, when you see the absolute best of humanity. So again, that's yet another reason to watch and to appreciate. Because although we did, and everybody on a Thursday night, and we banged our pots and pans, and we did all of that, this takes it to another level. I mean, we all thought we knew what was going on, but unless you were there, we didn't know.
Yeah.
No, we just didn't. We didn't.
No.
But the whole thing, I mean, it's done by Jed Mercurio, who everybody knows from Line of Duty. I mean, he co-wrote it. And he was the one that really, he came to you, didn't he? He was the one that really wanted to get this on screen. So there's such a passion for this project, isn't there?
Yes, yes. And our third co-writer, Prasanna Raja, like Jed Mercurio, is also a former doctor. So we had two former doctors, one current doctor writing the scripts. We had practicing NHS nurses and doctors in our cast. We had medical advisors who had worked through COVID, putting the cast through a boot camp. We wanted every medical detail to be so accurate that even doctors, nurses watching would not be able to spot anything that was inaccurate. And I don't think the NHS has ever been seen in such an authentic way before on screen.
It is authentic is the word, and very raw. Do you think, Rachel, that anything will change? Say this, God forbid, happens again. Do you think that we actually have learned anything? Will we, we can't let you all down the way that you were during this?
Yeah, I think mistakes are always going to happen in a pandemic. But what you cannot do, and it's unforgivable of a government to do this, is to tell a story to the public when they know that the reality is something completely different.
Yeah, it's called lying,
It's
isn't it?
called lying. Yeah. They said there weren't PPE shortages. There were. They said they'd thrown a protective ring round care homes. They hadn't. They said herd immunity wasn't a policy. But boy, did the bodies pile up in their thousands. And I think most fundamentally, in a pandemic, you get through it together. You have to trust each other and your government. And the most important lesson to learn is next time there's a pandemic, because there will be, we, the public, deserve politicians who look us in the eye and tell us the truth. And that didn't happen this time round.
Rachel, thank you. We have to say a Department of Health and Social Care spokesman said, we've always said there are lessons to be learned and we are committed to learning from the COVID-19 inquiry findings. That's what they have got to say. Thank you so much. Breathtaking, honestly, it is unmissable. Starts tonight, 9 o'clock on ITV1 and for the next 2 nights as well.